All right.
Yeah,
All right, we're live.
great. Top
Hey,
of the morning, or
hey,
whatever time it is where you are.
good morning, good afternoon, good evening, and good night, right? So thank you
Bonsoir.
everyone. Thank you everyone for joining in. And the headline of our webinar says lessons from both sides of the table. And today we have a guest who truly embodies the both sides. So I'm welcoming Aubrianna, who leads special projects at ABS Kids, largely focused on driving efficiency and patient experiences. A little bit about Aubrianna, if she allows me.
Of
Uh,
course, please.
Aubrianna is a self-taught expert in CRM software with over a decade of hands-on experience in user experience, user interface design. Uh, I've been working with Aubrianna on a project for a few months now, and uh, I know she excels in primarily within the autism services sector, and she works with ABS Kids. But identifying what to automate, when to automate, and what value that brings in for the organization, for the people, and patients. Uh, in my opinion, that's been her strength, and we'll talk more about it today. The only thing she may not automate though is her personal life. So a little bit of that.
I wish.
So she's married to a deep sea fisherman, a proud mom of two, splits her time between the Rocky Mountains and Cayman Islands. Now, the good part of this is she leverages the efficiency saved through automation and, invests that into hiking and swimming in the sea. So thanks for coming in, Aubriana. You know,
Thank you so much for having me, Akash. I'm really excited to be here.
yeah, so I mean, we're all ears about your journey. And before we, dive into the last 10 years in the ABS space, tell us a little more backstory of how did you get into the space?
Yeah, it's kind of funny how it all came about. I came from a medical space, and anybody that understands that the EHRs in that sector is a lot more robust than what we have or have had historically in the behavioral health services. And so I've kind of been, like you said in the introduction, self-taught. I came to ABS thinking that I was going to work at like an admin assistant office reception job, go back to school, and do something really good for the community, being that this was an autism facility. And it was far from a very slow paced job from the moment I stepped into ABS, which at the time our headquarters was in Salt Lake City, Utah. Um, it was high demand and a big learning curve for me, but I do believe that the medical side and knowledge helped me a lot. I had a lot of, I mean, the acronyms alone in ABS, or excuse me, in ABA services is wild. I mean, you have to learn, behavior techs, registered behavior techs, BCBAs, and I used a lot of comparisons in the medical field, like LPNs, CNAs, RNs, PAs, NPs. And so I kind of had this little guide for myself or cheat sheet to make it all come together. Um, I mean, I did everything at ABS in terms of operations on the admin and the back end, from onboarding new employees to new clients, scheduling, which once upon a time was done on an Excel spreadsheet, to benefits and authorizations, credentialing, contracting with our payers, understanding entities, and then all the way through to claims. And it was really cool because there was a necessity in the industry, and I kind of grab a, I took a hold of the reins there, and I thought, okay, I have a lot to learn here. But I accepted the challenge, and I think I was really supported by the our CEO back then was Jeff Skibitsky, who's still with us now, as our president of the company. And I think he saw that I was maybe a bit of an acrobat, and capable of, learning a lot about different areas of the business. And it gave me this understanding of the industry and the demand and, overall the need of what these communities and families were pretty desperate for. And it really, I guess, gave me this ambition and motivation to apply myself.
Yeah,
So I just,
you've done it all, seen it all, isn't it?
yeah, exactly.
So in fact, so when you got into the ABA space, what experiences with the patients and families made you say, this is something which really matters. I can spend a decade, which you've already done.
Mhm.
What were those gaps? What were those cracks in the system that, made you say, I can create an impact here. Uh,
I'll start with the insurance. And I think that's, forever kind of this bottleneck or at least frustrating point for ABA providers. And that's that, in that time, I think ABA was just becoming like an approved service through these insurance companies. And so it was a learning curve for them too. And I know sitting on calls for countless hours at a time, week over week, and finding out that these payers didn't really understand how to even provide us a benefit inquiry. Some of them didn't even know what ABA was at the time. And I think that was the turning point for me, one of many, but the biggest one that, made me feel like we've got to do better for this community and for these families. I mean, if you can imagine having a child on the spectrum and then being faced with, not being covered or being covered but not really understanding what that coverage looks like, I think it's frustrating and it's depleting. And I wanted to help these families. A lot of the time I was on the front line talking to them, and naturally I'm an empath, and I think that it just that those insurance companies really made me feel upset, and wanted to do better for our families.
In fact, when I speak to a lot of and Lead Squared has a decent presence in the ABA world,
Mm,
but we are making more presence felt. But now that gives me an opportunity to talk to a lot of people in the space, and I have a common theme which keeps coming or popping up is be it providers, practices, even softwares to an extent, a
mm,
lot of community leadership in the ABA world happens to be driven by, a personal story of someone in the family,
yeah.
someone in the community, and a lot of it is genuinely driven by, you know, the passion for care. So
Yeah.
that's what I've been seeing as well. But
I mean,
sorry, go
excuse,
ahead.
no, please finish.
No, in fact, I was going to my next question. When you usually start with passion and for all the right reasons, but scale is a different animal altogether. So when things start scaling up, and I know you and I had a chat and where you said, ABS kids also got to an inflection point and then scaled and scaled and scaled. How do you know, resist not making it very mechanical uh, and still carry that passion because that translates into the services or care that you provide. And
Yeah.
if you can, what is your secret sauce at ABS Kids?
I really love this question, because I think for ABS, it's this all encompassing understanding of the driving pieces. And that, is inclusive to the clinicians that are on the front lines with these families, the admin that are kind of the heartbeat, if you will, behind the scenes that are making this all happen, and then our families. And I think that we have this very cohesive way of communicating with each other, to improve. And in doing that, I think it has this organic way of ensuring that there's still this human touch in what we're doing at ABS, because we're not looking at it on a like robotic, let's get out of this manual mundane work and let's get into like this push for revenue. It's more about how do we make sure we're identifying these bottlenecks from everybody that's a part of this wheel that we're trying to keep, running smoothly. And I think it's that cohesive collaboration that sets us above, and everybody's drive to want to be better, and just community and tightness on all fronts.
Yeah, yeah, that adds a lot of value, and that translates through, like I said, in care, right? In your experiences with the clients. Uh, Talk to us a little bit more about people, processes, or maybe at times the process people. Uh, when workflows meet real humans, how do you still manage to honor both the sanity of clinicians and patient experiences? And how many change cycles have you seen in the last decade? And what were the inflection points? Because I'm assuming there has been a lot of change.
Oh man, has there. All for the greater good. I'll start with that. But I think it's this ability to have a collaborative um, working environment. But I think part of it is analyzing what's going on from a bird's eye view, but also being curious and staying well aware, um, or at least having some level of visibility on the day to day that's happening more at that ground level. That's kind of what I enjoy doing. I think 2 weeks ago, I shadowed our intake department,
Mhm.
and that's the department that your team over at Lead Squared is currently in the process of helping us with some automation. And I think that just that, curiosity of what's going on, and really like trying to get into the detail of the nitty gritty that I do believe some or other organizations kind of lose sight over time. I think it's really this passion of, okay, what does this look like? How is it affecting our families? And how do we improve this on every front? And those analytics go a long way. I mean, our data team works tirelessly to help us identify bottlenecks.
Mm.
And it's really evaluating those things and monitoring them over time, and using that as a drive to help us understand how we can be better.
Yeah, that makes a lot of sense. In fact, you mentioned you're a self-taught CRM expert, and we've seen, and I always say this, and this is uh, this is my observation, and I've not read it somewhere. There was a wave that EMRs brought along, right? And it was driven by a regulation. And I now see a wave where, every organization, I would like to believe every organization needed a CRM from the word go. But at least now we've reached a point where practices understand the value of a CRM. Uh, And then I have also come across, this is a slightly longish question, so pardon me. I've also come across practices which scale up suddenly and then try to retrofit, technology, processes, efficiency, uh, and maybe it's a little too late, something like building a plane while it's
An
flying. And,
analogy.
yeah, and I think this is something which you told me yesterday, right? If I'm not wrong, but uh, when do you realize, or what is the right time to really invest in something like this? To think about the future, proactively get ahead of the curve in terms of processes, technology, and when did you start realizing that you have to put a lot of these pieces together? What's your advice?
I mean, my advice would be as soon as possible. So the new startup companies, I would say, should invest right away in CRM, because it is harder when you're doing it in a reactive way, as most things are. Because again, it's that analogy we talked about on one of our recent conversations, which is to fly the plane, to build the plane while it's midair is tricky. And then there's burnout that comes with that. And then your families might get a taste of that. Although I do believe ABS has done an incredible job at managing that because we were one of the earlier organizations to get going. So we've kind of been, fortunate to grow as we learn as we grow in the CRM space. But I would say that, you it's again the curiosity of what's out there and what's available to you that's going to make you stand out and make you more efficient so that you can give that quality of care to these families. I think there was a second question in there, and I apologize, but as soon as possible is my first response to CRM.
No, so
Oh,
my
you asked me when. It was when did we, you said when did I? I'd
yeah,
like to take credit, but it wasn't just me alone.
no, the idea of asking that question was when does an organization realize or need to realize that, these are the challenges and these are the symptoms which need a certain medication, and that medication could be something which automates something like a CRM.
To me, a sheer sign is when your staff is burnt out, when they're expressing that they can't get the demand is too high. And I would look at that when when I refer to staff, I'm talking about the people behind the scenes, your administrative staff, as well as your clinical staff. I think that ABA, other ABA industries should invest in administrative support without having too many manual procedures, of course, because of overhead and so on. But I think it's really identifying with your staff and your clients when these things are starting to happen. I believe that if you have that human approach, that you'll be able to see that, and if you've got the right team members, they will be communicating that with you.
True. In fact, talking about technology, and I did introduce, I mean, I said this in my introduction. You spent time with developers, champion automation. Is there a story which is very close to your heart, where, I mean, stands out as a clear win?
Yeah, I have a few. I want to start by just giving everybody maybe a little chuckle because, back in 2010, when we started, I think there was myself, maybe it was 2011 at this point because I was not the only admin working. It was myself and another, a biller. We finally had some more humans involved in the process. And we used to make these carbon copies of notes. we
Mhm.
would we would take notes of like demographic details on these carbon copies, and we would the person that did the intake with the families would get this information, and then they would put the carbon copy into a basket, and the next person would call and verify the benefits, and then put the benefits on the back of the carbon copy. And it was this flow of attempt of communication because we didn't have the software to tap into being more efficient, or at least we were still learning about the software that was available. And so I think by 2018, I had gotten really curious with Central Reach. We were using it more for the electronic data collection for our clinical staff, which I think is what Central Reach is best at. And I started asking a lot of questions to our then CEO and then other people within the organization. I remained very curious. And I think finally, I don't know if it was because Jeff was annoyed that I kept bringing it up, or if he knew that there was potential, but he gave me an assignment to start, diving into that platform and trying to identify what it offered that we weren't, utilizing, and how it could benefit us as a business. And there was a lot of opportunity. I mean, look, we all know Central Reach, what that has its pros and cons, right?
Yep.
But it was, and I believe has remained, one of the better softwares for this industry. And it was a privilege. I mean, I got on the call. I think I was on the call with Central Reach at least 3 days out of my working week for 2, 3 hours learning. And at one point, I think I started teaching them about some of the capabilities that their system had, which was really kind of cool. Um, and yeah, I keep using that word curious, but I think it's that is don't be afraid to learn and challenge yourself and, dive into what resources are available for you.
Yeah. So the pain point, or the symptoms are, if there is high demand, if there are clients falling through the
Yeah,
crack, if you're missing communications to the patients, if you're just not able to manage wait lists, these are the symptoms that
100%.
warrant you to start looking for a solution.
You nailed it on the head there with the interest lists. Yeah, people falling through the cracks, really understanding the leads that are, aligned with the mission of the business and really catering to them without losing sight that there's other communities and needs out there that you can still support without having to prioritize necessarily, referring out, offering other opportunities. That's huge.
In fact, very, very broadly put, if pre-EHR, if the pre-EMR journey is in a bit of a mess, and you know the pain, but you do not know what's the quantum of that pain, that's where you may want to look out for something. Uh,
Yeah. Pull in some, I mean, I think and don't quote me on the year here, but maybe in 2018, yeah, maybe 17 or 18, ABS was bought out and we had a new executive team come in with experience, not in the autism industry. And there was this really beautiful collaboration between people that understood business and scaling and people like us that had been around that understand autism. And it was really great to have people with experience evaluate what was going on and give us guidance. So, leaning in on people that are out there that can support your business in the right way and not being, afraid of change.
yeah, that's a blessing, because uh, we see a lot of M&A, PVC activity in the ABA space as well, and
Yeah.
things can go south as well. But I think having the kind of relationship and leadership that ABS has is really phenomenal. You did speak about Central Reach and EHRs, and and the CRMs, Lead Square. Uh,
Hmm.
you know EHRs and CRMs usually act like they are at a family reunion, right? I mean, at least
Yeah.
they they want to be together. Uh,
The
what's your
ultimate goal.
Sorry? Yeah,
That's
the
the
ultimate
ultimate
goal, yeah.
goal.
It's so what's your recipe for actually getting them to work together? Because it's not just saying that there are two systems which work together, and in fact there have been EHRs and there have been CRMs which blur the lines and build another module as well, and may not necessarily do that well.
Mm-hmm.
But if an EHR and a CRM have to work together, what would your recipe be? How do you make them work together, and without a food fight?
Can I give a simple answer here? And that is opening up the API so that they can have this very seamless communication feeding in and out. But it's partnership, making sure that you're going into the relationship with whatever vendor, with trust and, confidence that they understand your mission and what it is that you need those two softwares to do. And then, presenting yourself the same so that there's no blurred lines on the mission and the goal with those with the softwares in mind. And yeah, I think that it's it's not simple, as you know, and your team knows, and people over at Central Region ABS knows. It can get very convoluted. I mean, look, we are still in implementation with Lead Squared. And we have this a passionate team that wants to ensure that this overhaul is done properly. And I think that because your team is very responsive to our needs and our team is very clear in what the goal is, it's going to ensure that the coming together of the EHR and CRM is doing it the way that it was designed, and that
And
it in turn has this positive effect on our clients.
yeah, in fact, I'm gonna take this opportunity to really thank the ABS Kids team. I think we spent a lot of time before starting the project, but rightly so, because
Mm,
the expectations were fairly clear. And
mhm.
that is what is the key to a successful implementation as well. I,
Exactly. Yeah. Be clear and be confident. I think your team has done a really incredible job at being forthright about what it can and can't do. And I think in the areas of where it cannot, which have not been many, you guys have a desire to figure out how to make that work. And that goes a long way.
True. And thanks for the kind words. Yeah, we strive to make that possible. So yeah, that's been the DNA. Moving on to the next question. Myths, missteps, call them whatever, right? What do leaders in behavioral health usually get hilariously wrong when scaling up? I mean, it's all good when it's a smaller setup, but when you scale up, you start making a few mistakes. And uh, autism services is a very hands-on why when it's largely been the story of the last 10 or 12 years. So
Right.
a lot of these organizations are now scaling up, becoming mid-market, large enterprises.
Right.
What can leaders get wrong, or what have you seen leaders get wrong?
I think it's that they may get caught up in the metrics, compliance boxes, and tech solutions, honestly. I think that you have to understand that those things are so important to the success of your business, but sometimes that can come in at expense. And you truly have to understand those operational workflows and the infrastructure of the ground in order to, steer clear of those missteps. And to a degree, the missteps are natural and they're a part of the growth process. And you have to have them in order to have those light bulb moments of we need to do better here. And those are okay, right? But getting lost in the sauce, right? Everybody's really eager to make sure that things are compliant and that the metrics are looking good. And it feels as though there could be some oversight on what's going on at that ground level.
Yeah, yeah, that makes sense. Uh, Aubrianna, you told us about the journey, right? And now that this space has really uh, heated up in a way, uh,
Good word.
if you could pass along a cheat code uh, to the next wave of, you know, healthcare leaders, behavioral health leaders, because you've seen it all. Uh,
Sure.
what would it be for career growth that doesn't set off, in a way, smoke alarms or burnout?
Yeah. I think the first and foremost thing is understanding the why behind doing what you're doing. So the mission, right? And not losing sight of that over time. And I mean, to add to that, you have to remember that at the center of all of this complexity, we're working with real families and the kids are counting on us. These communities are really counting on us. Don't be afraid of asking for help. Stay curious, be patient, be open minded. I mean, and lean in on people and resources that are out there to help scale and grow your business.
Yeah. And as a follow-up to that question, what are you seeing as a trend? I keep reading and talking to a lot of people within behavioral health, outside behavioral health as well. And like you may know, and you already know, Lead Squared largely works with the user set, which is either front office, intake, marketing, referrals, referral
Mm.
provider, the referral management team. Uh, we often get told that there is still a huge attrition, and that attrition is not necessarily, within the industry, it's people leaving the industry as well. Are you seeing
Mm.
such a similar trend within the ABA space? Because this is something which I've gathered across the industry. Uh,
It's not something I personally have tracked. Yes, it's talked about heavily. I know that internally at ABS and then externally with other people in the within the ABA industry, excuse me. And I think it's ensuring that you're passionate about finding answers to try to reduce the attrition. It's a very complex service, and I do believe that the answers are out there and that we're getting closer and closer to understanding them by really clear support. I mean, we were just on a call with our upper management team this week about, this RBT certification reality and recertifying, and it's a cumbersome task. And I think it takes a lot of labor to make sure that these people in this industry are really supported at that ground level. And I think, you know, we don't have the answers yet, but I do believe both ABS and a lot of other organizations are trying hard to figure it out.
mm, got it.
I will say that the ABA community is very family oriented, regardless if you're working in the same organization. And what I love about that is, there's all different kinds of platforms and accesses, that you can tap into, and you should, to talk about these things and talk about wins and how you're, figuring out how to reduce attrition and so on.
Yeah, yeah, true. Moving on to my next question, and again, this is again about you. 10 years, and I keep saying this because, I would like to explore all the aspects of this journey. 10 years, so many roles, so much progress. Uh,
Mhm.
it talks about a lot of quiet strength. So, what are some of your under the radar habits or traits that, people today in the audience, folks who want to, grow up the ladder into the ABA space, or are starting their careers or running operations, what should they learn? What are your secret weapons?
I don't know if I have a secret sauce, but I'll share what has worked for me. I mean, first and foremost, I'd always go back to the mission and understanding what we're here to do. And that's powerful, to know that we can make such a difference for these families and these children. Secondly, listening when it comes to what we're talking about within our organization and what's going on in the ABA industry itself. Being reliable, showing up, showing face, finding a balance between my work life and my personal life has been a huge factor because for me, I think it's safe to say that ABA is emotionally taxing to figure out how to make this all work. Psychologically, it can take a toll. So you really have to try to find a balance. I've not always been good at it, but I've made strides. And third is patience. Like you've got to know that I've been here for 10 years. I don't know if that's a testament to patience, but patience with CRM and EHRs, patience with your team being willing to adjust and change for you, because there's been a lot of change over that 10 years. And this industry feels like one that will forever be changing, especially when you have to consider the payers and all the things they're doing in the background that we have to adhere to and keep up to regulations. So being patient with all of that, and then lead by example. I mean, I try to have fun. I try to be personable, and I really try to make sure that the people that I'm working with are smiling through
Yeah.
it all. Yeah.
I think we've had a similar experience. I would not just say your team, even the vendors that you've been working with, or the partners that you're working with. have a smile. So it's been a pleasure to work with you as well.
Thanks.
What's next for you, Aubrianna? I know you pick up these special projects, kickstart them, implement them, and you did, point towards the fact that you have a new role or you're taking up a new project as well. What's next for you at a
I mean, right now, because I've taken on a new role, to be fair, my 10 years was interrupted by a 2-year consulting contract because I decided to be a mom
Mhm.
full time, which is a very underrated and taxing job. um, but I always found myself itching for more, and ABS has really provided that platform for me to be curious and challenge myself. But I think next I have this vision of, diving into more than just the central ops space, which is the admin side of ABA. I'd love to learn more about the clinical aspects because I think they'd intertwine so much that it would give me this other edge that I don't currently have, and something I've always really been passionate about and wanting to learn. So I hope in the next year or so, after I'm doing what I'm currently doing, which is, essentially analyzing what we're doing on that admin level from beginning to end, um, I want to transfer over to the clinical side of things and see if I can spark up some efficiency.
Mm. Talking about efficiency, uh, tell us, or let's try and give the audience a perspective. What is the kind of efficiency improvement that they should look for or aim for? Because, and I'll tell you, this comes from an experience of having spoken to a large set of practices where I often come across this challenge where they do realize that there is a pain, there is a leakage in intake, the intake is slow, the patient
Mm,
communication is not up to the mark, the experience is not great. uh, they know these challenges.
mm,
More often than not, they cannot quantify it,
mhm.
and that is where the decisioning goes for a toss. Because if you cannot quantify something, uh,
Right.
we feel the pain but we cannot quantify it, so what will it solve for? Things like that. How do you make sense out of this chaos that goes on, into the heads of the leaders at various practices across healthcare?
This might be a very like short answer to that question, but what stands out to me the most is what happened when we had our new executive team come on, which was this ability to run analytics and understand data. And I think that in this industry, you're looking at clinical data for quality of care, and that's first and foremost. But you should look at it on your practice management sides as well. You should really understand and monitor it. It's not just being in it day to day and feeling it, it's looking at it over time so that you can be prepared for the future. Data does not lie. If you build your criteria properly and you're looking at your baselines, you'll understand a story. You can tell story in numbers, and then listen to your people. Listen to the people that are on the front lines. That's the best I can provide. The data has been a game changer for us.
And to get that data, you need to have systems, and for the systems to work, you need to design your flows properly.
The
And
operations have to flow. We're still getting better at that every day. Every day. I mean, to be fair, there's only just the beginning of this wave of CRMs that are coming through and EHRs that are wanting to or have this software that's making it all possible. So staying ahead of that and making sure you're tapping into what they're offering.
true.
Game changer.
Uh, I think one last question before we open it up to the audience, if we have any questions, and then close. You spoke about efficiency and numbers and data. Uh, what's in store for ABS Kids? I know you'll not give out numbers, but uh, tell us more about what's in store for ABS Kids and What does the outlook look like?
Okay, so one thing that stuck with me when our now CEO came on board and we went to lunch, we were doing, kind of just getting to know each other. And he was coming to Utah often and we had a lot of meetings. And he said, we're going to be the big dinosaur one day in this industry. And the big dinosaurs eat the little dinosaurs. And so I'll leave with that. I know growth is always on the front lines for ABS, and that's so that we can get more services out there to the areas of need. So growth.
Yeah,
Yeah.
growth it is. I'll quickly take a few questions if we have.
Yeah, I saw some polls coming through and I didn't know if I was meant to answer those. I apologize for not being speedy to the response, but I wanted to stay engaged and not get distracted. It's an easy thing for me to do.
So
So,
we have one from Michael Wasser, and I think
oh, hey.
hey Mike, how does a CRM help families who are on a wait list? Uh, that's his question. Uh,
Yeah, it automates communication so that we don't have to have people rem- uh, setting up tasks or whatever cues it would be to have to do that. And I do believe that we still have a personal touch where after every X amount of auto comms that we're sending that we monitor in case people have responses to that. We're monitoring that daily. I do believe we do like a soft touch where we're having calling the families and still letting them hear the voice of a human.
And I think the personal touch never goes away, right? Uh, but something which you cannot track, which you do not track, and something which is difficult to find and reattribute in terms of weightage and priority uh, falls through the crack, and that's what CRM does really well. It
Mm,
can it can create a specific wait list, assign scores based on attributes, and keep you reminding on who to prioritize. And
yes,
obviously, the human touch does not go out, but it helps the humans, be more efficient with the wait lists.
exactly. I mean, I think that there's a bit of fear around this automation and this wave of capabilities, especially for people that are more on that administrative side. And I think that what we have to remember is the tech isn't there to replace us, it's there to help us.
True.
And yeah,
No,
exactly.
you put it succinctly. I mean, that's the best answer that could be. We have
Mm.
one more, which does not seem to be a question. It is more of a statement. Growing our intake pipeline at the rate to be sustainable. And that's about it. I don't know how to react to it, but if you have any reactions,
So
uh,
repeat it one more time.
it says growing our intake pipeline at the rate to be sustainable.
I think you have to identify what direction you're wanting to go in terms of growth. So sustainability to me is dependent on what your vision is for your business. Do you want to grow? Do you want it to stay, tight knit and small and only serve a subset of a community? If there's demand, to me, I would take on the challenge to grow.
You not turn down the demand. Yeah, I mean, it makes complete sense. Why would you turn down the demand? You'll arm yourself to be ready for the demand, right? I mean, that's the way it is. No,
Yeah.
this has been good. Thank you so much, Aubrianna. It's been
Yeah.
a great session. I hope everyone did gather a lot of learnings from you, and you have more folks coming into the ABA world with you being the inspiration. All the best to
I
you.
need to update my LinkedIn profile, it seems, because I'm getting a lot of connections there and I don't have to be honest, it's not on the forefront of my mind. So I'll be sure to uh, get engaged there so that I can be of whatever support and collaboration with other people in the industry. Thanks for all who showed up. Mike, I'm so happy you came. I didn't know you were here, but it's great. Thank you guys.
Thank you. Thank you so much. Bye bye.
See you.